Hello, welcome to episode 10 of Time of Death. I'm Ris,
And I'm Dee.
and we are two nurses who like to discuss true crime from a nursing perspective
Mhm.
with our medical and psychiatric background. So we're just going to jump right in. Just a fair warning for our listeners that this is a sensitive case. It deals with suicidal ideation, and there's also deaths of children and babies in this.
Oh my god, why are you doing this to me?
I'm sorry. It's a very tragic case.
You're talking about murder. Why are you doing this to me?
It's a tragic case, and it's recent as well. So, our case is about Lindsay Clancy. She was born in 1990 in Wallingford, CT.
Oh god.
She began as a nurse in Massachusetts, where she married Patrick Clancy. The two of them lived in Duxbury, which is about 45 minutes from Boston. So Lindsay was a labor and delivery nurse at Massachusetts General Hospital, and she was 32 years old at the time of the accident.
Mhm. What
Um,
accident?
so allegedly, she murdered her three children, and then attempt to kill herself by jumping out of a window.
Wait, I think I heard about this.
You probably did. It was very publicized.
Oh my god.
So there's three kids: 5-year-old Cora, 3-year-old Dawson, and then 8-month-old Callan. She was charged with murder, strangulation, or suffocation, assault and battery with a dangerous weapon. So she had used exercise equipment to kill the babies. So we're just gonna get into this. This deals a lot with postpartum depression and postpartum psychosis.
Mm.
Mothers who have recently given birth to a new baby have symptoms such as hallucinations, delusions, reality or disconnect from reality. They can have nightmares, panic attacks. Postpartum depression and psychosis can be caused by hormonal changes, life changes, sleep deprivation,
Mm.
increased anxiety, or physical changes as well. Oftentimes, mothers who undergo postpartum psychosis are unaware or unable to recognize the severity at the time, and then later on, they feel shock at the actions that they may have committed. So, Lindsay gave birth to her third baby, Callan, or Cal, in May 2022. She was on maternity leave from Massachusetts General. And in September 22, she started experiencing increased anxiety prior to her scheduled return to work date. So she visited two psychiatrists and they diagnosed her with generalized anxiety disorder.
Mm.
Throughout her postpartum period up until January 2023, which is when the killings occurred, she was prescribed 13 different psych meds for treatment of anxiety, depression, insomnia, etc. Medications such as Ambien, Klonopin, Valium, Ativan, Prozac, Lamictal, Remeron, Seroquel, Zoloft, Trazodone, Atarax, amitriptyline, Buspar, and Benadryl.
That's just crazy off the rip. Like, granted, like the postpartum care in the United States is very much lacking.
Mm-hmm.
Like, okay, they diagnosed her with GAD, but the polypharmacy that's going on is crazy. Like 13 different psych meds,
Yeah.
multiple benzos.
Yeah. So this is like all the meds throughout her. She was prescribed, I think, at most 4 to 5 different meds at one time. So these aren't all at the same time. And we'll get way into that because even her lawyer at the arraignment went into detail about how postpartum depression and postpartum psychosis is not given as much time in the light as
Yeah.
it should be,
Mhm.
and it affects way more women and mothers than you would think. And it's really just, the solution a lot of the time is throw
Go med.
medications at
Yeah.
it and just keep throwing meds at in different combinations, different dosages until they work. So this is just a really devastating case. So her husband, Patrick, said, okay, she took all the meds she was prescribed. She was very, very diligent about making sure all her medications were taken as prescribed. She kept a journal detailing daily activities, her mental state at the time, and medication use as well. She kept like tangible notes as well as notes on her phone.
Mhm.
So there was no indication of disorganized speech, hallucinations, delusions, etc. documented in these notes. They were extremely meticulous, clear, precise, articulate. She did write of intermittent SI or suicidal
Mhm.
ideation. She would document her difficulty with her medications, and then she would also document changes made by her psychiatrist and how they were going to combat her symptoms from then on out. On October 25th, 2022, she writes a note on her phone and it says, I think I sort of resent my other children because they prevent me from treating Cal like my first baby. And I know that's not fair to them. I know that. I was feeling so depressed last evening when Cora and Dawson came home from school. I know it runs off on them, so we had a pretty rough evening. I want to feel love and connection with all of my kids. So, this to me just kind of emphasizes that disconnect
Mm,
that she was feeling, and I think, yes, you can have it wanes and waxes the symptoms of postpartum
yeah,
depression and psychosis, and to me, just and I know the prosecution was really emphasizing, "Oh, it was so articulate, it was, like, so well thought out." You could still be psychotic and able
absolutely.
to plan and have your lucidity intact, you know what I mean?
I agree. It's less common presentation, but it still happens.
Mhm.
And then also you're looking at this, was she even in some kind of talk therapy? Like,
I don't think so. I could not find anything. We'll get more into the timeline. I could not find anything about like a psychotherapy, like talk therapy, which is just devastating because I think she was dealing with this a lot on her own. I mean, I
yeah.
know Patrick would check in with her a lot about her symptoms. Her husband would check
Mm,
in with her, but it's not treated the way, there's no exact way to treat this because it can vary so
right.
much and it just was not given as much thought and dedication as it should have been, to be honest. So, a couple months later, December 20th, 2022, she had an evaluation at Women and Infants Hospital for Women's Behavioral Health in Providence. She was told by psychiatrists that she had no symptoms of postpartum depression and was not diagnosed with postpartum depression or postpartum psychosis at this time. In late December 2022, she reported having feelings of wanting to hurt herself to her husband and also thoughts of wanting to hurt her children.
That's a okay, so right there, that should have been okay. She's gonna either hurt herself
Mhm.
or her children.
Mhm.
We need to remove her from the home.
And that is just crazy to me how I mean, I know these things can happen so fast and that going from, not actively a threat to your children to, okay, I'm gonna kill somebody. Like
No, it's gradual.
so at late December, she told this to her husband. She got help for this. January 1st, 2023, she had a voluntary admission to McLean Hospital in Belmont,
Mm,
Massachusetts. And she stayed there for about 5 days and was discharged home on the 5th of January, 2023. She was deemed safe, no risk to herself or others. And the time after this, she had been feeling better per her husband. She resumed all normal behaviors, activities. She stayed alone with her children at times. And she was improving for all intents and purposes. In mid January 2023, Patrick asks Lindsay explicitly, do you have any SI or suicidal ideation? Which she denies. On the weekend of January the 21st, 2023, Lindsay's parents visit and interactions were appropriate, normal behavior. Lindsay's mom watched the kids. Lindsay went and ran errands, just like normal. January 22nd, Lindsay texts her mom to make sure she got home safely after their visit. And mom says, "Nice to see you doing better." That night, Lindsay, Patrick, Cora, and Dawson, which are her two older kids, have dinner at Kyle Carney's house, who is Patrick's friend.
Mhm.
And Patrick says that she was behaving pretty normal. She was at her baseline. Nothing really concerning happened during this dinner. And Patrick had confided in Kyle about Lindsay's struggles with the anxiety about returning to work, difficulties with medication regimen. And she had also been trying to taper off benzodiazepines
Oh god.
as well. So he had been confiding in friends and family about their struggles.
Mhm.
And obviously her mom was aware and she had a bit of support. I still don't think it was adequate. I think there
Mhm.
should have been definitely more intervention for her there. I don't think that was safe. The day before the crime took place, January 23rd, Lindsay writes in her diary that she has a touch of postpartum anxiety.
Mm.
January 24th, 2023 is the day when the crimes occurred. That day, Lindsay took Cora to her pediatrician for a doctor's appointment. Interactions with reception, nursing staff, and the doctor were all normal. Her and Cora left the pediatrician after their visit. Everything was good. Lindsay came home and was playing in the snow with Cora and Dawson. They built a snowman together. Lindsay was texting photos of the kids playing to her mom and to Patrick. This is all normal behavior. Okay. Then we're going to get into a strict timeline of everything that went down that day. At 4:02, Lindsay searched on her cell phone kids' Miralax. So maybe her kids were struggling with pooping. I don't know. Anyway,
Mhm.
at 4:13, Lindsay searched Takeout 3V in Plymouth, Massachusetts. There's a restaurant called 3V. So after she searched Takeout 3V, she did apps to find out the distance from her house to 3V, like
Yeah.
how long it would take to get there. At 4:47, she searched for CVS's number and called CVS in Kingston to ask if they had kids Miralax, where she talked to the manager. Manager said, okay, she seemed normal. Everything was pretty much
Mhm.
like every other
Coherent,
conversation
yeah.
I've had with a customer. At 4:53, she texted Patrick, and Patrick was working downstairs in their basement. They have his little home office area. And so he was working, and she asked via text if he wanted takeout from 3B because she didn't cook anything for dinner. And she said it's been a long day. And he says, "Yes, I do. That sounds good." At So then she's like, "Okay, at the menu, see what you want. Let me know." So he picks out something for himself and lets Lindsay know at 5:06, and then Lindsay calls and places the order at V3, gives Patrick's name, and the person who took her order there said, okay, she was normal too, like
Mhm.
nothing was out of the ordinary. At 5:15, Patrick leaves to go get the food and also to pick up kids' Pedialax liquid stool softener at CVS. So at 5:32, he arrives at CVS, makes the purchase, calls Lindsay at 5:33. She doesn't answer. At 5:34, they end up talking on the phone, and she tells Patrick exactly what she wants for the kids, the medication she needs, and Patrick later says she seems a little bit distracted, but it wasn't really that concerning to him. At 5:54, Patrick picks up takeout at 3B, and during this time, it's about 55 minutes until he comes back home. Lindsay had killed Cora and Dawson using exercise bands to strangle them and had used exercise bands on Callan as well. He was severely injured, but he was still alive. And then after she had killed those two and attempted to kill Callan, she jumped out the second story window of her bedroom and she landed in the lawn. She was severely injured as well. At 6:09, Patrick comes home. She had like, been in the backyard laying on the ground, so he didn't see her. He didn't see anything off at first. So he comes home, doesn't hear or see anything, which is weird because 'cause you've got 3 kids
Yeah.
and you would think you'd at least hear something or see something. He tries calling Lindsay, she doesn't answer. He tries opening the bedroom door and it's locked, but he did manage to get it open, and he saw blood on the floor in front of a floor-length mirror in the room, and he sees the window open, and then he panics, runs to the backyard, finds Lindsay, who had cuts on her wrists and neck. Bleeding was controlled. He calls 911. He asks Lindsay, "What did you do?" And Lindsay says, "I tried to kill myself and jumped out the window." Patrick asks Lindsay where the kids were, and she tells him they're in the basement. EMS comes, and Patrick tells them to stay with Lindsay while he goes and gets the kids
Oh
inside
my
the house in
god.
the basement. So he still has the 911
On the
on
phone.
the phone. He goes into the house, he goes down into the basement, and 911 can hear him say, "Guys," like, calling out for them. And then they hear screaming, and they hear agonizing, painfully devastated screaming. So Patrick found Cora and Cal on the floor in the den area, which was to the left. And he also found Dawson in the area to the right where Patrick's home office was. All of them had exercise bands still in place around their necks. Dispatch is hearing him screaming and saying, "I need help, I need help." And so they send officers down. And Patrick is trying to save the babies. He's saying, once he sees the officers, he says, "She killed the kids." Cora and Dawson were brought to the hospital where they were declared dead. Callan was life-starred to another hospital, and he stayed on life support until he passed away 3 days later. Lindsay was transported to the ER and treated for injuries to her spine. She had broken bones in her rib cage and her back. On that same night, January 24th, Patrick was interviewed by police, where he had said that she was having one of her best days. She seemed happy. There was no indication that she was any threat to herself or others, or including her kids. A couple days later, on the 27th of January, Lindsay uses a whiteboard to ask, "Do I need an attorney?" She was intubated at the time, so prosecution is using this as like a she's aware of the crime, she is able to protect herself, that whole thing. On February 5th, 2023 at 1:35, Paul Zeisel is a psychologist hired by the defense team, and he is there to evaluate Lindsay's mental state. And Lindsay uses his cell phone to call Patrick. He doesn't answer. She leaves a voicemail and says that she loves him. And then the next day, February 6th, 2023, at 10:09, Lindsay is with Zeisel again, where she uses his phone again to call Patrick, and the two have a conversation. And she tells Patrick she had a moment of psychosis after he left, and she heard the voice of a man telling her to kill her
Mhm.
kids and herself because it was her last chance. And Patrick denies ever hearing that Lindsay had ever heard voices in the past. On February 7th, there was an arraignment. Her lawyer, Reddington, said that Lindsay is still suicidal. She's extremely emotional. However, she's unable and has been unable to express any happiness or sadness or cry. He also goes in depth about how society is unable to treat postpartum depression and postpartum psychosis. And the treatment is typically, medicate, change meds as needed. And he says that women or mothers struggling from these conditions are completely abandoned by society.
Mhm.
So the defense is saying she's over medicated, wasn't able to differentiate right from wrong at the time, and that she had postpartum psychosis, having hallucinations, delusions. Prosecution, on the other hand, says, okay, she was never diagnosed with postpartum depression or postpartum psychosis. They're also saying, okay, these crimes were obviously premeditated. She was able to search how long it would take for Patrick to go from the restaurant to home and was able to see that he'd be gone for X amount of time. And so I'll have this amount of time to commit the crimes and, kill myself and all this stuff. Okay. And they also said that there were closer restaurants nearby that they would often get takeout from, but Lindsay had chosen to get takeout from 3V. And they had ordered from there before, but they're just saying, okay, she chose this specific place so that he'd be gone for this specific amount of time.
If prosecution ever looked at where I order from, clearly they would judge me very harshly.
Where do you order the most from?
I'll order from Chipotle, and then I'll order from freaking 2 towns away if it fits my fancy.
That's true.
Doesn't mean that, and I will argue this for her because I'm on her side. Just because she felt like 3V doesn't mean that this was premeditated.
That's true. So, prosecution's also saying she was only prescribed 4 to 5 meds at one time. At the time that the crimes were committed, only 3 medications. She was only prescribed 3 medications. I don't know what those 3 meds were.
It's okay. I forgive you.
Thank you, Dee. That really means a lot. All right. So, everyone who commented on this case, who knew Lindsay, including friends, family, Patrick, people that she's worked with, all said how out of her normal that this behavior was, and that she clearly was not in her right mind to have committed these crimes. She was not being treated correctly, and there wasn't really much of an effort placed to treat those extremely concerning symptoms that she was going through. So since January 24th, she has been at Duxbury Hospital, where she'll be staying for the time being for medical and psychiatric treatment. Since she had jumped out the window in an effort to kill herself, she is paralyzed from the waist down, and there isn't any indication that she'll be walking anytime soon. So here I just want to talk a little bit about Rachel Waters. She is another victim of postpartum psychosis. She had, I think, 4 or 5 kids, and she had postpartum psychosis with 2 of those pregnancies. After she had her son, I think she said it was her 2nd and 4th child. So just because you've had 2 normal, like Lindsay had 2 babies and, coped pretty well with, and with her 3rd baby, that's when she had increased anxiety and all of these psychiatric issues that followed. But prosecution, I know, emphasized, she had these 2 normal postpartum periods with her 2 other kids. Why did she not have a normal postpartum with Cal, her latest baby? And it's like, okay,
that doesn't mean anything.
That doesn't mean anything. No. You can't just kind of dismiss postpartum psychosis because it's not uniform for her other pregnancies.
They couldn't even diagnose it right.
Yeah.
They diagnosed it as GAD. How did they know she didn't have it?
And what's crazy is that postpartum psychosis is an anxiety-based disorder. It's based on anxiety. You could have a wide range of symptoms with postpartum psychosis and even postpartum depression. And all of it, for the most part, is anxiety based. And it's that huge concern about, saving your children, or something's wrong with your baby, or, just all this stress that's put on them.
It's so sad, but in some good news, I think that there was a new FDA drug for postpartum depression that recently was approved.
Okay. What was it?
Let me look it up because I cannot remember anything anymore. Zurzuvae? I might be saying it wrong, but the FDA approved this med to treat postpartum depression in adults whose symptoms range from sadness to loss of energy to cognitive impairment and suicidal ideation. And you take the drug for 14 days. I thought that was so interesting.
That is interesting. I'm glad it's getting at least some recognition.
Yeah, and it's an oral medication option.
Yeah. Oh, that's good.
Yeah,
That's good. So back to Rachel. She thought that her son was possessed by the devil. She heard like radio music playing all the time. She heard voices. She said that she was basically living in fear and fighting off the voices that she was hearing. So one day she's out for a run with her husband and she turned calmly towards him, and her husband said her eyes looked a little distant, and she said, "I have to go home now and say goodbye to the kids." And her husband says, "Why do you have to do that?" And she said, just simply, matter of fact, "Because I'm going to kill them."
Yikes.
So thank goodness her husband was a physician and he was able to recognize these symptoms of postpartum psychosis, and he was able to get her treatment immediately.
Good.
Thank goodness. But Rachel talks a lot about postpartum depression and postpartum psychosis. The treatment for postpartum depression and postpartum psychosis is not uniform. There's no standardized care for patients experiencing these conditions. It varies from patient to patient. Patients demonstrate very complex behaviors, and it can be extremely difficult to predict behavior, especially of psychotic patients.
Yep.
Again, 1 in 7 moms experience postpartum depression. That's 50 to 80% of new moms. They can experience things like mood swings, irritability, anxiety, changes in appetite, feelings of not being good enough, seeing themselves as a bad mom. 17% of postpartum depression patients experience severe symptoms, and 0.2% of new moms experience psychotic symptoms or postpartum psychosis. That is 2 moms in every 1,000. They present a danger to themselves and to others, especially their babies. They can experience disorientation, delusions, hallucinations, emotional volatility. They can have catatonia. They can have disorganized thought process. They can have strange beliefs, such as seeing subliminal messages in like billboards or like a magazine or the newspaper.
Delusional.
They just, like Rachel Waters was saying, she would see billboards and think that they were speaking to her, and they can feel like they have like divine powers. And basically a lot of the time when they have this psychosis, they have a feeling that they are in a position where they need to save their babies and themselves from evil or from harm. And, they feel like it's their only option. And the psychosis makes them think that they must do it. They don't have a choice. The only way that, like, even when Lindsay was talking to Patrick and said she heard a male voice telling her that she needed to kill herself and her children because it was their last chance. And we don't know if maybe it was her last chance to save their souls or to give them salvation, or who really knows what she got from that message. But I do believe her actions, and not saying that they were right or correct in any way. They were psychotic, but her actions were done in what she thought was the best interest of her babies and her family, it's just devastating that it just got to that point. But these symptoms can wax and wane. They can appear lucid, just like we've talked about how prosecution pointed out how she was able to plan the murders of her babies. And she was able to, let me send my husband out so he won't be here, so I'll have enough time and, just plan
But
every detail. But you can have the periods of lucidity
mhm,
and you can still plan when you're psychotic.
absolutely.
You can. And it's just, and something that I thought of, especially when Patrick was saying, this was one of her best days, is the day of the murders, January 24th, when he like said she seemed hopeful. And I think it's because she knew what she was planning to do.
Yeah,
And she thought, okay, this is the day I'm going to save my family. And so it is warped. It's psychotic, but I do think her intentions weren't evil.
I absolutely agree, and I think those are some really excellent points.
Hmm.
I know that working in the psychiatric field, that a red flag to me is when the patient starts doing really, really well.
Yeah, exactly.
And I think that's what happened with this young woman. And I think that she needed more support.
Hmm.
And I think that she was projecting an image of what she thought everyone wanted to see.
Exactly. And they can fear their kids being taken away. They
Mm-hmm.
can fear themselves being locked up. And so they try sometimes, I think, like you're saying, to present themselves in a better light so they don't have to be a burden for their
Absolutely.
loved ones. And I do think that's what Lindsay was doing. And her mom pointed out, too, when she visited, like, it's so nice to see you doing better.
Mm-hmm.
And her husband, what felt like it was safe to leave the kids home with her. And I really think that she probably didn't want to let them down and let them know what was going on with her. Like, even in her journal, I have a touch of postpartum anxiety. I think maybe it was kind of like, trying to downplay the symptoms
Mm-hmm.
and make herself feel normal. But I mean, I can't fathom what she was going through.
And I think she was a nurse, right? An L&D nurse.
Yep.
And it's interesting because she knows her way around the healthcare system.
Mhm.
She knows she tried to be the best advocate that she could for herself by doing notes, taking her meds,
Following up with multiple
yeah, she knew
psychiatrists,
something was wrong.
voluntarily admitting herself to the hospital.
Absolutely.
Like, she tried everything and it just,
And it's interesting because you mentioned initially that she was feeling more anxious at the thought of returning to work.
yeah.
And I know that really any type of nursing is going to be stressful, but L&D, she's around babies
Mhm.
and moms and,
Mhm.
someone that's struggling right now. Who's to say that that stress isn't the tipping point that just pushed her over the
Yeah.
edge?
And also being away from her own babies was
Mm-hmm.
probably causing her stress because she probably
Absolutely.
felt like she was the only one that could protect them.
Mm.
You know what I mean? But
Even through all of that psychosis and the obviously horrible actions, I think that it sounds like she was coming from, as twisted as it was, a place of love. It wasn't something that she was trying to be vindictive or evil or
I
hateful.
agree. Yeah.
I think she was, like you said, trying to, whether it was save their souls or
Hmm.
do something to keep them safe under, even with all that not being in the right state of
Yeah,
mind.
exactly. So 5% of postpartum psychosis patients commit suicide. The number one cause of death is suicide and maternal death up to 1 year postpartum. 1/3 of postpartum psychotic patients who do get help express delusions about their babies. Just like Rachel saw that, she thought her baby was possessed. I'm not sure what exactly, if she did have any delusions, what they were, if Lindsay did. 4% kill their babies. So 5% of postpartum psychotic patients commit suicides and 4% kill their own babies. So this just, you're able to recognize how serious this is and just making sure to educate other people. Like, you don't even have to be in the healthcare field to educate And you don't have to just talk to pregnant or postpartum patients about this. You can talk to other people. You could talk to men who've gone through this, or you can talk to a wide range of people because many people can relate. They know a person who's pregnant, they were pregnant, or, they love someone who's pregnant. And especially being in the healthcare field, just, making moms aware of the severity that they can be going through with the postpartum depression and psychosis.
And better recognition by the physicians or
Exactly.
practitioners or healthcare providers that are, you need to recognize it in order to treat it.
Yes. Yes. And once again, the mental health community, the medical system, let this woman down and let those babies down.
Absolutely. I agree.
And they've let down postpartum patients who've gone through psychosis or depression as well. Because this is not the first time this has happened where a tragic event has led to the death of babies.
Look at the maternal mortality rate. Look at the infant mortality rate.
Yeah.
We are at the level of freaking third world countries, people. We are not freaking the superpower level for those. And it's so sad because these are the people that are historically marginalized by healthcare. And forget it. If you're not even going to get adequate healthcare, you're definitely not getting adequate psychiatric care.
And the part that crushes me the most about this case is how diligent Lindsay was about trying to advocate for herself.
Yeah.
She tried so hard to confront the issue that was causing harm. She journaled every day, very meticulous. She obviously was dedicated to preserving the health and safety of her babies
And herself.
And it's just a devastating case. But Patrick, I'll end with these words. Lindsay was generously loving and caring towards everyone. Me, our kids, family, friends, and her patients. The very fibers of her soul are loving. All I wish for her now is that she can somehow find peace. And Patrick has forgiven her, and he asks others to do the same.
You hear a little purring. It is little fluff boy Bubba.
Yeah. But thank you all for listening. Dee, do you have any final comments?
Yeah, I just want to... I agree with everything that Ris touched on. We need to do better for these moms and their babies.
Yeah.
We need to have more supports in place. We need to have better recognition of postpartum illnesses. Not just not even just psych.
Yeah.
Like, we need better postpartum care in general. We need better care for women. We need better care on a psychiatric level. I'm part of the psychiatric healthcare workers, and I'll tell you, it's not great.
It's terrible. To be honest, it's terrible.
And we don't have a good enough understanding. A lot of times we throw the medication to the wall, see what sticks. Talk therapy is fallen by the wayside. That's something that's pivotal. How are you gonna you still have these thought processes? Look at CBT. CBT is designed to replace negative thoughts with positive ways of thinking, rewiring your brain essentially.
Yep.
When are we doing CBT?
Yeah. And
who's doing CBT?
There was no talk therapy, CBT, or anything like that for Lindsay too.
And
it was just medication. Let me change your regimen. Let me adjust your dose.
14
Let me go through
different
these
meds.
14 different meds.
Because it's easier.
What that works best.
It's easier. It's easier. It's a cop-out. And you know what? You got to sit down, be invested in your patient, talk it out.
Yeah.
Are you having command hallucinations? She did this because of command hallucinations. There was a man telling her, you have to do this. Time is running out. And you know what? Did they assess that? Did they ask?
They blatantly said, you have no symptoms, not even of postpartum psychosis, but postpartum depression.
Yeah, that's wild.
That affects 50 to 80% of moms.
Shame on
And you're
them.
going to say, oh, no, you're just anxious. It's just generalized anxiety disorder.
It's just your
That's
nerves.
it.
Just your nerves.
Yeah.
You're
but
good.
let me hit you with all these psych meds. But it's just GAD. It's nothing. But, you know what? Let me just give you these meds.
You know what? And this is why it's so important to advocate for yourself. If you're not a healthcare worker, advocate for yourself.
Yes.
If you're a healthcare worker, advocate for your patients.
Exactly. And you know what? I don't mean to say GAD is not a serious, sometimes debilitating condition, but
It's totally different beast.
Yes. In this case, she was not just GAD. There was a lot more going on here, and you can tell by the devastating end to this story. But yes, I'm sorry that we talked about such a sad case again.
Rest in peace to the little angels.
I know.
Rest in peace. And we cannot do any more baby cases. My heart cannot take it.
Deal. We won't.
Please.
Okay. Anyway, so we have an Instagram if you'd like to follow us, if you enjoyed listening to us. We're on Apple and Spotify, and we make episodes every week, every Wednesday to be exact. So, Dee, do you want to call it?
I'm going to call it the time of death is 2018. For all you non-healthcare or military personnel, it is 8/18. And just want to give a special shout out on the airwaves to little Wolfie, who is turning 1 year old.
Tomorrow.
1 year old tomorrow. And she's such a good
baby
girl.
cat.
Yes, we love Wolfie. Ris's cat. Shout out to Luminari. Shout out to Bubba. Shout out to
All
Jack.
of you.
You
And
forgot
Jack.
about my dog. Wow. Wow.
We
So-
love you, Jack.
Get the hell out of here. You totally neglect me. Go, and all of you. So sweetly. But no, we do
And
love
all
you
of
guys
you.
too. All of our dedicated listeners. We love you. And there are not very many. So you are very near and dear in our hearts.
Very, very. All right. Bye.
Like, subscribe, share, tell everyone. Help us get one step closer to our retirement goals.
Keep killing it.
You're killing
Bye.
it. See you next week. Bye.